The White House Coronavirus Task Force says that South Dakota is one of the states topping the red zones for COVID-19. That is according to the Center for Public Integrity, which obtained the reports. The red zone means that the area has more than 100 new cases per 100,000 residents. The White House Task Force report is telling red zones that masks must be worn indoors and in all public settings, and group gathering sizes that should be limited. KELOLAND's Angela Kennedy joins us now with an update on the situation at South Dakota hospitals.
Well, first of all, we asked Governor Kristi Noem's office to see the White House Coronavirus Task Force weekly report provided to the state, but we're told it's not theirs to give us. KELOLAND Investigates has found a couple of South Dakota doctors posting on social media about what it all means for them. This tweet by a Sioux Falls Avera doctor says he can't even express how concerned, tired, scared physicians, nurses, and frontline workers are in South Dakota right now. He says they're stretched more thin than ever before, and it will only get worse. He also questions whether the governor will ever acknowledge it. A Yankton doctor issued a warning on Facebook. He says record cases in South Dakota mean hospitalizations are likely to increase. He says hospitals are already diverting patients. He says in addition to beds, hospitals need people and resources. Now, I asked both doctors for an on-camera interview. Both told me they cannot do that at this time. Hospitals tell KELOLAND News that between 10 to as much as 20% of their patients have the virus. That, combined with people who put off surgeries when the pandemic started and those who need care for other issues, means that South Dakota hospitals are starting to feel the impact of crowding. Tonight, in our COVID-19 Beyond the Numbers coverage, we see how the rise in cases impacts patients and how specifically Sanford Health is handling the influx.
77-year-old Judy Limmer was scheduled to undergo shoulder surgery in June.
With all the COVID around, I kind of decided to wait.
She rescheduled her surgery for mid-September. The Limmers say the procedure was a success and she was well cared for. However, they did run into one hiccup in the hospital.
Then they told me, well, we're going to have to wait a little bit because there's the recovery, or she's going into recovery, but they didn't have a room ready for her. So, we waited around or I waited around for quite a while. She was in recovery all that time, and finally they came and told me, well, okay, we've now got a room.
It wasn't until 4 hours after her surgery that a room became available.
Yes, we're busy. We 100% acknowledge that, and because we have been, but it's not like we're at an area where we need a National Guard set up or anything like that.
Sanford Health officials tell us they have doubled up on patients in fewer than 10 rooms and are sometimes treating patients who need intensive care in the emergency room while they wait for a bed to open up in the ICU.
There are times we ask patients to receive great care, but perhaps in an unusual location. Maybe wait in the ER for a little bit, maybe wait in one of our outlying facilities for a little bit.
Sanford Health points out that anywhere from 80 to 120 patients are sent home each day, and that fall is always a busy time in the hospital, even without a pandemic. Sanford says it currently has the staff and space it needs to keep up with demand as COVID-19 cases rise.
So is there a tipping point?
It's, you hate to always use the term it depends, but it really depends. I don't have a number that's a tipping point. It really goes into the space, the staff, and staff illnesses and things like that. There's just a daily basis we're taking inventory and being transparent with that inventory with our own staff as to where we're at.
Dr. Wilde says just this morning he met with surgeons to talk about the option of limiting elective surgeries that require an overnight stay in order to free up more beds. However, at this point he says it's not necessary to take that step.
Thank you, Angela.